Welcome back to the panel discussion on state of health and women and child development this afternoon. The state of health is intricately linked to the state of women and child development in India. The National Health and Family Survey 4, the National Health and Family Survey 5 have time and time told us about the incidence of early age malnutrition, childhood stunting, and the links with maternal health. And what that goes on to do is significantly hamper India's demographic dividend in the coming years. We have a panel of distinguished experts to discuss these issues with us today. We have Mr. Debanjan Roy, Senior Deputy Secretary of the Women and Child Development Department, the Government of West Bengal. Shri Debanjan Roy is a Master in Commerce and WBCS Executive of the 2002 batch. She's worked as the Block Development Officer and also as a Deputy Magistrate at many districts and as Sub-Divisional Magistrate of Gangarampur Subdivision. He's presently serving as Senior Deputy Secretary at the Department of Women and Child Development and Social Welfare in West Bengal, and he looks after Lakshmir Bhandar, Jai Bangla pension projects, and the budgeting of this entire department. Let me speak a little to Lakshmir Bhandar, a women financial empowerment program faced by significant problems such as the scarcity of cash in hand of women members of the family, especially in light of the pandemic, social exclusion of marginal women, and encouraging women empowerment with financial security. The government of West Bengal, Department of Women and Child Development, deployed solutions such as the facilitation of the Lakshmi Bhandar program for regular unconditional cash transfer to women, a monthly direct benefit transfer of rupees 1,000 to SC and ST women and rupees 500 to other category women. They ensured the transfer solely to an adult female member's bank account linked to Aadhaar and the Swasthya Sathi scheme approved candidates. The provisional registration of beneficiaries, even without these mandatory documents, and speedy dispersal of documents through individual handholding of beneficiaries, and the outcomes were immense. They received 1.86 crore applications, ladies and gentlemen. 1.7 crore applications were approved, and rupees 5,758 crore was disbursed. It facilitated the provision of establishing identity and social rights of SC, ST, and economically deprived women, and entails an outgo of rupees 850 crores per month from the coffers of the government of West Bengal, targeted at the women between the age groups of 25 to 60. We have with us Mr. Debanjan Roy to share his experiences, the challenges they faced, and the innovations that they deployed to help this solution come to life. Mr. Debanjan Roy, very welcome.
Good afternoon, respected SKOCH team members, respected panelists, and respected participants. I would like to thank SKOCH team first of all for providing such a wonderful platform for lateral learning on different projects we are taking up at different parts and corners of the state. Government of West Bengal introduced one of the largest social protection scheme, which aims at financial empowerment of female members of all the families except those who are in government employment, to direct transfer of cash benefits to their bank accounts. The female members of the families were chosen deliberately as the beneficiary of the scheme, as it was observed that women are more savings oriented and more prone to send their savings towards education and health of their children and other family members, and to support the families in unforeseen events. The name of the scheme was given Lakshmi Bhandar, keeping in mind the tradition of Bengali households to save small amounts of money by the female members in a piggy bank, which is also named after goddess Lakshmi, the goddess of wealth and prosperity. Lakshmi Bhandar is a social protection scheme aimed at financial empowerment of women. All women aged between 25 to 60 years in West Bengal were enrolled in Shastro Shati and not in government employment are entitled to receive this scheme's benefits. The only exceptions for women were drawing a salary or pension from the government. Women from SC/ST households are getting rupees 1,000 per month, and other women are entitled to get rupees 500 per month. The scheme was launched on 16th August 2021 in a Duare Sarkar camp. Duare Sarkar camp is a outreach initiative of government of West Bengal, where government itself is coming to the doorstep of the family, to the doorstep of the citizens. So camps are being organized at the remotest of the villages, at the mohallas where poor people are residing, so that the citizen can easily come and apply in those places. As of now, since August 2021 till October 2022, we have received 1.92 crore. 1.92 crore, almost 2 crore applications have been received, and 1.8 crore applications have been already approved. And we have disbursed rupees 12,562 crores. Per month, we are disbursing almost 1,000 crores. Till October, we have disbursed rupees 12,562 crores. It actually aims at improving the financial condition of all the families of West Bengal. Department of Women and Child Development and Social Welfare is the nodal department of this scheme. The objective of the scheme is to ensure the social security of women by providing them with basic income support every month so that they are able to finance their day-to-day expenses. This is very important. The marginal women, most of them did not have any bank account itself before. After this introduction of this scheme, their bank accounts have been opened. Now they can come outside their home, can operate their bank accounts, can take the money being transferred to their bank account, whichever may be the amount, and they can decide on it, how to spend it. Our team visited some of the beneficiaries recently and interacted and asked them, how are you spending these amounts? So some of them told that they are purchasing pencils, pens, books for their children who are studying in schools. Some of them told they are buying some medicines for their family members. Some of them told they are investing those amount in their small businesses being run by them individually or through some self-help groups. So they use the money as per their own choice, as per their own decision. But one thing was common among all of them. Their position in the eye of their family, in the eye of their society has been enhanced. Other people from their family, from the society have started respecting them. That was the major objective of government. That is why the scheme was deliberately made very simple. Only very few basic documents were required at the time of application, and that application can also be made nearer to their homes, at their doorsteps. Camps were being organized where they could apply. So they did not feel any difficulty in coming forward for application of the scheme or for using the benefit government is delivering. Lakshmi Bhandar beneficiaries can apply by collecting the designated numbered forms from their nearest Duare Sarkar camps, block development officers in rural areas, and subdivisional magistrates in urban area arrange such camps, apply application forms, collect and digitize the forms. The applications are entered and recommended in the designated portal by BDOs or SDOs for sanction by district magistrates. In case of Kolkata, Kolkata Municipal Corporation handles those things. As the data is matched with and derived from Swasthya Sathi approved database, only a valid Swasthya Sathi card holder can come under the coverage of this scheme. Lakshmi Bhandar portal bank integrated gateway has been created to ensure direct benefit transfer from department itself to the bank account of the beneficiaries on a monthly basis. Thus, technical portal solutions have resulted in smooth running of this large scheme. How is the portal, social security portal we have developed? How is that portal? It is responsive. Application is built in web responsive manner to run in mobile and tabs, etc. in addition to desktop. Applicants get notified with every stage of application process and payment process. The digitization platform, the server is also the digitization platform. Applicants' data and important documents are entered into and stored into this portal. And this also minimizes use of paper, because once the data are entered into the portal, there is no need for paperwork. So in that manner, it is environment friendly also. There are multi-level check mechanisms, entry-level check with Shastashati database, then restriction of duplicate entry in terms of mobile number, bank account, Aadhaar. So if any specific mobile number has been already entered, you cannot apply with that same mobile number. If some bank account has been already entered in the system, you can't apply with that same bank account. Similarly, is for other. So there is a duplicity check. And at the middle tier, that is at the end of video and SDO also, there are regular deduplication exercises. Payment gateway, every bank account is validated through NPCI. Approved successfully validated cases are sent for payment through the payment gateway for direct benefit transfer through the integrated portal and bank payment gateway over secure API. Ample MISs are available in the portal itself. So budget, how is the budgetary provision? The annual budgetary support is rupees 12,000 crore. See, Government of West Bengal has analyzed the entire problem through a gender lens, and the solution they have provided is women oriented. That's why in this single scheme itself, a budget of rupees 12,000 crore has been provided, and it has already catered almost 1.8 crore beneficiaries. Government of West Bengal constantly endeavors to maximize the operational efficiency of the scheme. The checks and filtering process begins at the very start. The provision of crediting the monthly transfers directly to an other linked bank account held solely by the eligible adult female members of the household ensures both the prevention of multiple transfers to a single beneficiary and real woman empowerment, as every beneficiary needs to have a bank account held solely by her in order to receive the benefit of Lokshmi Bhandar every month. The bank account is in the woman's own name. She is the one who takes the decision about how to dispose of the income. So it provides a sense of ownership and identity. The cash supply in the hands of women has increased to a great extent, resulting in an increase in purchasing power among common people. The women empowerment objective has been attained. Regular income support to women has started having a positive impact on the life of the entire family. Increased cash supply has resulted in higher demand in the economy. Transformational effect on the lives of the poor and vulnerable of the state. And most importantly, it leads to real women empowerment and advance the general well-being of the populace. This amount has enabled the women to fulfill their felt needs. It has offered a taste of financial freedom and strengthened their position in family and society as a whole. Their inclusion in the banking system has given a boost to the economy. The monthly investment being injected has given the demand push into the economy required to kickstart it in its usual pace in post-COVID scenario, where women participation and women empowerment are the focal theme. I would expect that this kind of projects will go a long way in women empowerment and overall recovery of the economic system. So thank you all of you.
Thank you very much, Dr. Debanjan Roy of the Women and Child Development Department of the State of West Bengal, sharing his perspectives on the Lakshmi Bhandar program. We're joined by Ms. Ayushi Sudan, Chief Executive Officer of the State Health Agency, Jammu and Kashmir, for the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and ABPM JEY Sehat scheme for J&K faced by several challenges, including healthcare risk management, a high out-of-pocket expenditure for patients, poor infrastructure of public hospitals, and low penetration of the private sector. The department in Jammu and Kashmir deployed several initiatives such as a beneficiary identification system or BIS developed by the NHA to identify and verify the beneficiaries at CSCs and points of care. They deployed a transaction management system developed to facilitate transactions from hospitals, such as filing pre-authorization requests and claim submission, and the training of PMAMs and medical coordinators, and they've been able to reduce catastrophic health expenditures, and more interest has been shown by private healthcare providers for empanelment. There has been a development of public health infrastructure, and 170% of claims outgo, out of which 102% was purely in public hospitals, which indicates strengthening of the public hospitals by the scheme and greater utilization by beneficiaries. We're joined by Ms. Ayushi Sudan, who will be speaking to us about this initiative. Ms. Sudan.
Thank you. Thank you so much. Actually, I'll be representing SHA on this. I'll be representing SHA in this forum. What is the basic objective of the Sehat scheme? So basically, as we all know, that Ayushman Bharat PMJY scheme was launched in the country in health insurance to basically provide a premium insurance cover to the socially backward and economically backward classes. Now, J&K has taken it to the next level by actually inclusion of all families under PMJY, under a new umbrella scheme called the Sehat scheme. So, Sehat scheme is a scheme wherein each and every family of J&K UT is covered and is entitled to a health insurance cover of 5 lakh rupees. It has focused towards accessible, affordable, and quality healthcare. So, what is the purpose of it? What do we achieve by actually launching this scheme? Not only have we reduced the out-of-pocket expenditure on a very, very large scale, we have actually empowered our public hospitals, which receive the claim revenues out of the scheme for any health upgradation, any quality certification, and multiple uses, in fact. And it is, in fact, the first steps that we have taken towards the universal health coverage. And I would say that Jammu Kashmir will be the first UT and probably the first state also to have insured its entire population. Right now, I have 94% of my families who are beneficiaries of these schemes. More than 901 crores have been spent on free treatments, and 5 lakh people have actually received benefit out of the scheme. So it is actually based on a very, very robust IT ecosystem. There is no paper trail anywhere from your beneficiary registration to your claim settlement to your actual payment by the insurance company to the hospitals. It is completely IT enabled, which also in turn helps us in identifying any frauds that may occur during the course of the events of the implementation of the scheme. And more importantly, it helps us identify some very, very important health trends. For example, since most of my population is now covered under Ayushman scheme, since most of my population is covered under Ayushman scheme, what happens is that now when a person goes to actually request that his Ayushman card be availed. So each and every around 50 to 60% of the treatments anywhere are actually under Ayushman. My public hospitals are seeing IPD conversion rates of 90% or even more in certain cases. Several government hospitals are receiving an annual turnover revenue of the score of 10 to 20 crores, which they in turn help in, which in turn helps them in infrastructure upgradation. What I wanted to say before was, because I'm covering such a large population base with my Sehat scheme, I'm able to establish certain very important health trends. And And because of the fact that because the uptake of the scheme is so huge. What I have established in the say 6 months of my CEOship in SHA, what we have seen is that certain procedures, certain daycare procedures are actually highly, demanded in the private hospitals. So we can actually segregate, we can actually focus on what ailments uh, the people are, facing in our public and private hospitals. It has brought wonders for the health of the people. Since this particular seminar is also with regards to the women and child development, I also like to mention here that JNK basically has one of the highest institutional deliveries percentage in the entire country. That is at 95%. Since maternal and child healthcare remains the core of healthcare delivery at a rural health level, so we are all in SHA and in the state health society also making several initiatives to improve our deliverables, our indicators, and there has been remarkable improvement also in the last few years. For example, the under 5 mortality rate has actually reduced significantly by 5 points from 21 to 70, which is much better than the national average. We have introduced a midwifery program wherein we intend to reduce the number of cesareans and promote natural birth care. Um, and uh, our Ayushman Bharat health and wellness centers also all across more than 2,500 Ayushman Bharat health and wellness care centers promote this antenatal and prenatal health care to a great level. So, one thing that I really would like to point out here is, uh, in order to enable a better healthcare delivery, one of the aspects is grievance, a very strong and robust grievance mechanism. Second is making it accessible to each and everyone, and the third is to basically digitize. And for making it accessible, we need to basically digitize the healthcare. Again, in which we are doing a lot. For example, in Ayushman Bharat, as I said, we already are completely online. We do not rely on any paper trail. Apart from that, also, we have a very strong HMI system, which is a hospital management information system, which is going to be integrated with our transaction management system of the Ayushman Bharat Savings. Wherein what happens, we are covering more than 577 facilities of our state to the level of PHC. We're also in the process of actually integrating uh, to the level of the sub-center level, so that all the data we are able to track and uh, plan according to real-time data that we receive on these portals. For example, if there's somebody who goes to an IPD now, he can either avail his golden card, which is the Ayushman card, or he can opt not to choose the golden card. But nevertheless, his electronic medical record shall be recorded, shall be recorded on our HMIS portal, which when put on the cloud and with very strict data privacy conditions as well, we can actually access from anywhere, and we can, which in turn actually promotes interoperability between our district, between the different states of our country. So, as I said, these are the two pillars that we are really heavily relying on: a very robust grievance mechanism, and the second one, as I said, making it accessible through digital means. Uh, how do we enable a robust grievance mechanism? We have we have a 104 centralized helpline, which makes regular calls to all the people who are actually availing treatment under Ayushman Bharat and takes their feedback. We also have QA-based feedback mechanism available in each and every private and public hospitals, wherein each and any patient can raise a grievance. Apart from that, there are helplines, there are multiple portals on which the person can raise a grievance, and it has so happened that several people have raised grievances and they have been addressed, and we've got a very good response. In fact, JNK was also awarded for 100% quality grievance redressal a couple of months ago. So it is actually a very it's a convergent effort on the part of the health and medical department of JNK, wherein different aspects of healthcare are being taken care of, be it from the SHA side or the state health societies, which is the NHM side, or say the medical supplies corporation side. Because to achieve any integrated healthcare and accessible and affordable healthcare, all of these components actually need to be uh, need to act in a convergent manner so that our health outcomes, our deliverables are achieved. Uh, so that is all from my side.
Many congratulations, Ms. Sudan. And I think that begs the question. You mentioned that you've been able to drop the under 5 mortality rate, reduce it by 5 points, way above the national average. What is the critical success factor, according to you, that has enabled you to do this in Jammu and Kashmir, madam?
So two things actually. First, we have a very robust ASHA base in our villages. A very important ASHA cadre, which is manned by regular ASHA cadre at the top. So that is one. Trainings of ASHAs have been very critical. In fact, secondly, secondly that we have seen is that we have promoted institutional deliveries in a big way. So there are still pockets in Jammu and Kashmir, for example, say Doda and Kishtawar, where institutional deliveries are less in number. But if I see most of Kashmir now, people are also so aware that they do access these particular sub centers or PHCs, and they do. And they have also become so aware, and their health seeking behavior has also improved over the years, that they go for institutional deliveries, and that actually results in a marked reduction in unemployment.
Let me let me also add by saying that Ms. Sudan is a 2017 batch IS officer of the AGMUT Carter, and we'll come back with several questions for Ms. Sudan. In her career, she's served in various capacities across the state. She served as the Additional Deputy Commissioner of Hayuliang, Arunachal Pradesh, the Deputy Commissioner of Anjo, the Special Secretary for the Department of Planning, Finance and Investment, Arunachal Pradesh, and Special Secretary in the Chief Minister's Office of Arunachal Pradesh, and even served as, well, currently the CEO of Ayushman Bharat's PMJEY Jammu and Kashmir. She's also the Mission Director for the National Health Mission and Mission Director for the Ayushman Bharat Digital Mission. In an academic career, she completed her BSc in Physics and MSc in Physics from St. Stephen's College, the Delhi University, and she's been awarded the SKOCH Award for the Mother School Project as Deputy Commissioner, an Anjo Award for Best Performing UT for Golden Card Generation, PMJEY. We're also joined by Dr. Raju Jotkar, who's Senior Consultant and Technical Lead of the Department of Women and Child Development, the Government of Maharashtra. Dr. Jotkar is a retired Joint Director of Health Sciences from the Public Health Department, Government of Maharashtra, who served for 38 years in service. Post-retirement, he resumed as Senior Consultant with Rajmata Jijo, Mother and Child Health and Nutrition Mission, Department of Women and Child Development, Government of Maharashtra, funded by UNICEF from the 1st of August 2020. He has served as a research scientist at the Center for Global Health Research at the University of Toronto, and as a research scientist during 2007 to 2011, has 35 publications under his name in international and national journals, including 2 in the Lancet Journal. Dr. Jotkar, are you with us?
Yes, I'm here. Thank you.
Your video.
Thanks for your introduction. Just as you introduced, correct it, I'm not sure.
Dr. Jotkar, I believe there is a lag in your video. We're not able to see the video, sir.
Yes.
Please continue.
Okay, let me talk very briefly. See,
Dr. Jotkar, I think you have logged in through two different devices. So we request you to log out from one device.
only I'm on laptop only. So can you help from the backend?
I guess the issue is from your end.
What is the solution then?
To simplify, do you have two devices in front of you? In case you do, could you please kindly mute one? And if you could speak on the other, then we will be okay.
I have access from the laptop only.
Okay, then in that case, sir, can you please turn your laptop's mic or volume down, and then we shall be able to hear you.
Okay. Am I audible now?
Yes, this is perfect. Thank you, Dr. Jotkar. Kahiye, please.
Hello?
Jotkar, we can hear you. We can hear you, sir. Please continue.
Hello? Am I audible now?
Yes, you are audible. You are audible and also visible.
Okay. Just quickly, see the migration during the COVID pandemic has witnessed devastating effect on the poor migrants, and it was having livelihood crisis as well as life crisis also. So during this era, the state of Maharashtra tried to institutionalize the enrollment of migrants, particularly the women and children, because the mandate of women and child development was women and children. So rather than encompassing the whole household, we tried to restrict ourselves to our beneficiaries, means lactating woman, pregnant woman, as well as children from 0 to 18 years. And the evidence was that there was a feminization of vulnerability due to seasonal migration. I'm referring to seasonal migration only, and prosperity-driven migration. I'm not worried about it, because the whole aim was to ease out the discomfort of these migrants who are going for lean during the lean period and try to earn their livelihood during the lean period. And during the process, from source to destination, they get deprived from their entitlements as well as the services at the source level. So sometimes the mother goes and the children stays back, and they carry children also somewhere. And then if a child is carried, it acts as a sibling. It is used for sibling care, but it gets deprivation from its schooling. So all these permutations and combinations, we work on that. So the ICDS and ICPS, the child protection as well as the child nutrition services, including immunization, the ICDS encompasses 6 services, and ICPS also have some component service. We try to see that how can we best ensure the portability of these services wherever the migrant goes. And we developed an app. We piloted this in the 5 districts and 1 block of Gadchiroli. The execution started in 21st November 2021. 1 year of its execution has faced us much of learning. Now we have expanded it, and recently rolled out to the whole of the state, and cost was very less. We could the tangible benefits are so much that even though the coverage everything is not well, but the institutionalization and the workload and the acceptance by the frontload functionaries is picking up slowly but firmly, and that has given us a confidence that we can do something good for the migrant women and the children of the given household, and we can ensure the portability of services. That's my brief account. Thank you.
Well, thank you very much, Dr. Jotkar. And I think that there are follow-up questions for the speakers of this panel. Mr. Jotkar, if I may ask,
Yeah.
what is the situation in Maharashtra wherein through e-Samiksha you're doing online compliance monitoring? What is the status of that and how is that faring?
You are talking of monitoring of migration, na? So we have got an app which we have piloted in 5 districts and 1 block of Gadchiroli, that is Sironja. And then our Anganwadi Sevika knows the potential migrant households in the given in her jurisdiction. She, from the family health survey done in April, she shortlists it and puts the name as a potential migrant in the app. And if they happen to migrate, she tracks it whether they have migrated or not. If they migrated, then she also captures where they are going, what will be the potential destination would be. Therein, the destination site, if the migrant beneficiary has reached there, then her name is accepted in the app, and then the service entitlement are disabled at the source and enabled at the destination. This is how the portability of services, all ICDS services as well as ICPS services, keeps on doing. And then after they return, again the enabling phenomenon get reversed. During the course of this, the portability of the services at the destination, how much we can do it, that is also monitored. So at present, we have something like 35,000 migrants we had enrolled in the pilot scheme, of which 25,000 actually migrated, and we could make available services to 15,000. So this was the overall status of 5 districts. That is what I'm saying. The reasons of migration wise also we have seen, whether they are sugarcane cutters, whether they are bricklayer workers, whether they are agricultural laborers, or they are stone cutters, something of that sort. And they have given better insights for that. And then the vulnerability associated with the reason of the migration also. So this is the in nutshell the monitoring side. There is a dashboard, and we are in constantly touch with, because the app is user friendly. The destination and the source team both are aware of it, and the interface through the app makes it very feasible for that. Besides that, we have got helpline also that is located at the district headquarters, which helps to track the migration, which is little difficult, because sometimes the work at the destination finishes within week, and they are taken to destination 2. In that case, some problem occur, and then thereby the helpline is very useful for the frontline supervisors and the workers. Anganwadi Sevika, that is what we call in Maharashtra. Hope I have answered the question.
Thank you very much, Dr. Jotkar. Do we have Dr. Debanjan Roy with us? Dr. Roy? I believe we've lost Dr. No, we have Dr. Roy with us. Dr. Roy, we would like to ask you this afternoon. West Bengal has provided financial and technical support to women-led projects in Purulia, in Jalpaiguri, in Dakshin, Dinajpur, Malda, and other districts. And you're also running Kanya Shri Prakalpa, which is a cash transfer scheme. Dr. Roy, the question to you is, how can we supplement such social security schemes through capacity building and livelihoods training for comprehensive economic empowerment, in addition to cash transfers?
Actually, we are doing some kind of synergic work, so that all the, along with the cash benefit transfer, some capacity building is made. So in case of Konyasri, we are running the Konyasri class, where different skill activities are being educated to the school children itself, so that they can take up their trade they want to take in future life. Along with that, there are several actions being taken, so that the women can involve into self-help group activities, where the group is lending some money to them, so that they can start their own businesses. And there are also some banking training, some capacity building is being made, and whenever they produce some products, there are sales support from the side of government, so that though the products being built up by the women small self-help groups. Those are being displayed in the government stalls, in the cities, in the and their online platforms are also being created so that anybody sitting at their room can order a specific kind of product being built up by the women self-help group members. So there are some bridging activities are there, so that along with cash transfer, the cash transfer, you see, that is the very basic thing. For the girl students, that is being given as a scholarship. Also, in case of there are cash assistance in the form of Rupostri, so that they don't indulge into child marriage before 18 years of age. But after all those cash, along with those cash transfers, steps are being taken so that they can actually earn their livings and can get their employment in the real life. For that purpose, different kind of soft skills are being taught to them. And another very important Konasri Plus activity is self-defense activity is being taught to the girl students, so that they can prevent themselves any untoward in case of any untoward incident. So they can apply their karate skill, their self-learning defenses skill, so that a holistic plan is being taken along with these cash incentive schemes, so that women empowerment takes place in the truest of its sense, so that they can take up their career as per their will, so that their health precautionary measures are being taken. So sanitary napkin is being prepared by women self-help groups. They are being given those trainings also, and they themselves are making the general villagers aware that they should use sanitary napkin. So different kinds of steps are being taken so that holistic women empowerment takes place, and the cash incentive is the very first step to initiate their self-respect, initiate their to enhance their position in the from the eyes of the general people. But ultimately, a holistic development of the women is the policy of government of West Bengal, so that a holistic development takes place.
Thank you very much, Dr. Roy. We have an audience question coming in for you. My team informs me. The question reads as follows: How can West Bengal improve its performance as far as a higher female workforce participation rate, particularly in rural areas, is concerned, and what efforts are being taken to address this challenge?
I think where I just finished in the last question, I can start from that point itself. In the rural field itself, we are making some skill development trainings for the women self-help groups, and they are being educated about their what trade they can take up, what can be market friendly. Those kinds of steps are being taken. Another work it has just started. We cannot tell much about that, but we are not in a situation to tell much about that. But government of West Bengal is also thinking about women employment itself. Kind of separate steps and targeted steps are being initiated, so that women workforce engagement is increases. Specific steps are being taken along with general soft skill development, marketing skill development, general lessons about banking activities. Steps are pinpointed steps are being taken, so that women employment policy is being taken, so that women employment can take place. For that purpose, different departments are coming under one umbrella, and they are sharing their steps. But that part is only in a very primitive stage. Hopefully, by 1 year or 2 year, we will be taking those steps also. But at this moment, there are several steps, and there are some steps for making coaching special dedicated coaching camps for the girl students also, so that if they want to take up any specific career, maybe medical or engineering at the +2 level, or maybe some competitive exams in the level, government is running some kind of coaching camps also in different levels, at the district levels, at the state levels. different coaching camps are also being run. And for taking up small businesses, there are supports from different banks. There are interest subsidy for the women employment, for the women engaged in self-help group activities. And there are skill development trainings, different kinds of skill development training. So those steps are being taken.
Thank you. Thank you very much, Dr. Roy. And I believe there's a question from Ms. Ayushi Sudan. If we have Ms. Ayushi Sudan from Jammu and Kashmir with us, I believe she's engaged in a conversation, as we can see on our cameras. We'll go to Dr. Raju Jotkar before we conclude this panel discussion. Dr. Jotkar, I believe that there is also the possibility of exploring an integration between the migration module in the Poshan tracker and integrating it with the Maha MTS tracker. What are your views and perspectives of this interplay between both? And is there also a geolocation element, and does that open up data privacy challenges within the state?
Very, very good question. I mean, that's our dream step, the end goal, rather you can say. I mean, the Poshan tracker has they are thinking of envisaging a module wherein they are making it demand driven and reactive mode. Means at the destination, if the beneficiary visits the Anganwadi center, then they will be enrolled and the services will be made available. But our app starts from the source. We track the potential migrants, and then we track its migration to the destination, and destination we make it disabling and enabling of the app makes it feasible for making the portability of services uninterrupted. So that is how ours is a proactive supply driven model. And then we have in dialogue with NEGD, we have flagged this with CPR dialogue 2022 also at Delhi. And then we have yesterday only we have received an email request from NEGD, that is the one who is involved in devising the Poshan tracker, and they want to know the philosophical thinking, the coding part of it. And we will be next week we'll be in trying to influence them. So if they could do that, the risk in their shortcut is that there is a likelihood of deprivation of so many, because the sugarcane cutter go the migrants go to field only. They are not in this village or not in that village, so they are less likely to visit the Anganwadi center or health wellness center. So in that case, unless until we track it, it's not possible that the services are made portable. So that is one thing. And then regarding the geolocation, at this point of time we have not envisaged that, because we are working on an open source platform. But in Maharashtra, we have done a geolocation of all 110,000 Anganwadis. Based on that, we have made, restructuring of urban. See, the urban cities are engulfing the villages around it. And then the rural Anganwadi is now part of cities and still governed by Jilla Parishad. So that we have rectified as a pathfinder exercise. So we have got a team of, vibrant engineers from IIT, and Sitara IIT Mumbai is with us, technically collaborating with us, and UNICEF, our unit is funded by UNICEF, and we are acting as a think tank to Department of Women and Child Development. So that is possible only after stabilizing the current platform and then making inroads in a Poshan tracker. If our model is accepted as the Poshan tracker, that will be the dream goal we are looking at it, and then we can add value like geolocation and all those things. Thank you.
We'd love to study the interplay of the Poshan tracker and the Maha MTS at a later point in time, Dr. Jotkar, and may
yes. Yeah.
Thank you very much for staying with us through this panel discussion.